Okay, so I've got Sarah with me today, and Sarah, you've got a really unique perspective because you're a woman who was diagnosed with cancer, but you're also the mother of a child who's been diagnosed with cancer. Can you share a little bit about your personal experience?
Yeah, so in August 2022, my son Benjamin was diagnosed with ALL, acute lymphoblastic leukemia. And shortly after, I found a lump under my chin, and I also was, after biopsies and scans, I was also diagnosed with a rare salivary gland cancer while my son was going through treatment. I also went through cancer treatment. And my
And
son
so,
is currently still in treatment.
and are you still in treatment?
No, I finished my treatment last July. So now I'm just being followed for the rest of my life. I do have an aggressive salivary gland cancer, so it's just lots of scans every 3 months.
The timeline between the time you went to go see your primary care physician to the time you were diagnosed?
So the timeline was I went to see my family doctor in September to tell her that I found this lump. I think not thankfully, but because of what I went through with my son Benjamin not being misdiagnosed for so long, I think I had more like advocacy in me to like speak up for myself, because at first when I showed her the lump, my doctor thought, oh, you probably are just getting a little sick, like let's just wait and we'll follow up with it in a couple of weeks. And I said, no, I want to get an ultrasound. Like I want to get some scans done.
Did you feel like you needed to advocate to get testing done for your son?
For my son,
Yeah.
yeah, so what happened with him was he was just feeling really sick, and it was a long weekend, so I brought him to a walk-in clinic. And at first I told them that he was vomiting a lot, and he was just like not eating anything and very lethargic. And they were like, oh, well, his ear is a little bit red, so it could be because of an ear infection. And I thought that was weird, but they gave him some antibiotics, and they gave him an anti-nausea so that he could keep water down, because everything was just coming out. And then, like, the next day, his eye was swollen, so I brought him to the hospital, and I just kept getting dismissed. They were like, oh, well, that can happen with an ear infection. I was like, I've never heard of like an eye swelling with an ear infection, but I'm not a doctor, so I don't know. So they sent us home with more antibiotics. The next day, he was still so sick, just like so not himself. I've never seen him like this before. So I went back to the hospital, and I said, I want blood work done. And I will never forget the ER doctor saying, well, he's not going to like that. And I was like, yeah, I understand he's not going to like that, but like I need to figure out what's going on with him because he's not well. And so they did blood work, they did a urine sample, and finally, like after 8 hours of waiting in the ER, the um, the ER doctor said, "Oh, there's some inflammation in his blood, so we're gonna have pediatrics come down to talk to you." And while I was waiting for pediatrics to come, I noticed that his forehead was now swelling, like there was like a lump under it or something. And the pediatric doctor, actually asked me, "Well, did he hit his head while you were here?" And I was like, "No, he didn't hit his head. Like this just happened. Like he's barely moving. He's just stuck on me." So I really had to push and push. Finally, they admitted him to our local hospital. We were there for 3 or 4 days, and all they could tell me was that he probably had a sinus infection or something. They weren't sure, but the antibiotics were working because his eye was going down and the bump on his forehead was going down. And throughout our whole stay there, he was getting blood work done. Not once did the doctors ever tell me that anything weird other than a little bit of inflammation marker was going on. So we were discharged, and then a week later, he was sick again. And I brought him to Sick Kids, and that's when he was finally diagnosed with leukemia. I really had to push.
That it's just incredible. And so on the Collab Conversations podcast, the last one I had with Keith McIntosh, who's the chair for the the Advocacy for Canadian Childhood Oncology Research Network. And in that conversation, he said to me that he felt like as a father going to the hospital with a child, he was able to advocate, like he didn't have to be as demanding as if a mother was there with their child, where people would say that she was emotional or she was overreacting. So do you feel that rings true for you?
Oh, 100%. I forgot to even mention the worst part of my experience at the hospital with my son was after we were discharged by the doctor. I was emotional for sure. Like, I was scared that this was going to happen again. And the doctor looked at me and he said, "You just have to trust me because I'm a doctor and, he's fine. Like, I see sick kids. Your son isn't, like, he's healthy." And I was like, okay, like, I have to listen to this doctor. And then I went back when I told you he was still unwell. I brought him back to the local hospital because I figured they know his story. They know what's going on. And that evening, the ER doctor called the pediatric doctor that we had seen, and he came down. He didn't even examine Benjamin. And he said, "You need to stop bringing your son to the hospital. He picked up another virus because you keep bringing him to the hospital. And you shouldn't be bringing him here unless he's vomiting up blood or something drastic like that." Those were his exact words to me. And in that moment, I just felt like, okay, like, it's all in my head. I must be like crazy. I must be like an overbearing, like a mother that's just like too emotional, right? Like, he's obviously fine, but deep down inside, I just knew he wasn't.
Yeah. I mean, it's so frustrating and it makes me so angry. But at the same time, I feel like if you hadn't had to advocate for your son, it sounds to me like you wouldn't have advocated for yourself when you were in front of your physician.
Yes, exactly.
And so
That definitely helped.
yeah, I don't remember if I asked you, what was the time of diagnosis for you between the time between the time you saw your family doctor and the time you actually were diagnosed?
Oh, it took a really long time. So I had my first ultrasound at the end of September, and then I had a CT scan and then an MRI in January, the end of January. And then after that MRI, they confirmed that there was a tumor in my salivary gland. But I had to go for 2 biopsies. They kept coming back inconclusive. That's finally when I was transferred to Princess Margaret, and they had to do surgery. So it wasn't until after my surgery, I think it was May 4th, that I was finally diagnosed.
Wow, that's like almost a year.
Yeah. I feel like I was definitely talked to like it wasn't a big deal.
Mm-hmm.
At first, like, my family doctor, when she called me to tell me that they found a tumor in my salivary gland, and I was worried, and I was like, what are the statistics with this? And she was just kind of like, "Oh, it's not a big deal. Like, we're gonna send you to the specialist, and they'll take a look at it, but usually it's benign." And I was like, okay. So, if you Google salivary gland cancer, most of them are in the parotid gland, which it says like 70% benign. So at that point, I was like, okay, it is what it is. But then I remember I had signed up at the hospital that did my MRI, and they, on Sunday night, that was like a Friday afternoon. On Sunday night, they sent me the report that my family doctor would have seen. And I opened it, and everywhere it just said highly concerning. Like, basically, it was saying that it was malignant because of where it was. Mine was not in my parotid gland. It was in like my sublingual, which is like very rare. And
it's actually 80% chance that it is malignant. So I feel like because my doctor knows how I am, that I am highly emotional, that maybe she felt that she just needed to like reassure me and like not give me the full truth. And then same with like the first ENT doctor that I saw here. I was emotional, I was upset, I was scared. And she was like, "Oh, it's not a big deal. Even if it is anything, it's just, you'll have like a little surgery, maybe some radiation, and it's not going to affect you. Like, but like, there's really high chances that it's nothing." And so, of course, that felt nice to hear. But in the end,
Mhm.
that's not my story. That's not my reality.
Yeah.
Um, yeah.
But I think those are normal reactions to being diagnosed with a rare cancer also. Like
Yeah.
I feel like I would feel exactly the same way, and I don't know why in healthcare it's important to suppress those feelings when you're talking to your healthcare professional.
Experience like with my oncologists who are both men, like my surgeon and my radiologist. They're like incredible, so talented, and like so good at what they do. But I do feel that at any time that like I start to express like, because it is a rare cancer, it's hard for me because I feel like I have to do my own research because there's not much research out there, right? So I go in with my list full of questions, asking all the questions, and I feel like they kind of dismiss it like, "Oh, that's not relevant," or "Don't worry about that," or so, you know any little thing that I feel, or like now I'm looking into like a lump in my breast, and I feel like I'm just sent to like, "Oh, she needs psychosocial support." And I'm like, "Well, I also just need you to listen to my concerns." And yeah,
Yeah.
of course I need psychosocial support. That's helpful for anybody going through this.
Yeah, but I think that's a really interesting point that you're bringing up, is that like you're aware of your body, and the healthcare professionals are the experts, but they're not in your body, so they don't know when something is wrong the way you know something is wrong. And
Yeah.
so like when you're going to them and you're saying this is not right, and they're saying, well, you need psychosocial support, which I
Yeah.
feel is like maybe something they wouldn't necessarily do, like if your husband went to see your oncologist.
Yes, I 100% agree. Actually, my husband has come with me to a couple of appointments, and I did notice that they would go more in depth with the questions that he was asking and kind of brush off the things that I had asked previously. Like I didn't get the same response.
Oh, that's really interesting. I wonder why that happens.
Yeah, I don't know.
I don't know either. So what would you like to say? I don't know that any healthcare workers are going to listen to this, but if healthcare workers were going to listen to this, what would you like to say to them?
I think the biggest thing is that, like, we know as patients, we know that you are very knowledgeable and good at your jobs, and we appreciate everything that you do for us and that the medical world offers us. But we know our bodies best, and it would just be nice if we didn't have to push so much to get answers, or have to it just feels like sometimes you're not being heard or you're not being believed, and you feel as though you're making something out of nothing, when actually both times in my life it has been the worst case.
Yeah.
So just listen to your patients, I think, is like the biggest thing, is like, the medicine, and like the protocol afterwards, but you don't know what's going on in someone's body, and everybody is different. Like, although maybe
Mhm.
it's nothing in someone else, you never know, right?
Yeah. And what would you say to other women who would be facing a cancer diagnosis, and also to other women who would have a child who has a cancer diagnosis?
um for women that are facing a cancer diagnosis, I would just say, like, pay attention to your body and what's going on, what makes you feel good and what makes you not feel good. Never stop advocating for yourself if that means like I know it's uncomfortable, but if that means like going in with a list full of questions and not leaving until you have those answered or making another appointment to have the rest of them answered, like you have to do that. And there's no shame in getting a second opinion if you feel you're not being heard. Like make that appointment and just make sure that you're being heard. And again, if your doctor isn't the one that's listening, find someone else. Find someone that will.
Yeah. And that could be like a patient advocacy group too that
Yeah,
will help you direct you to the right person.
that's right. Yeah.
Yeah.
And then for parents that are going through this, for mothers that are going through, having their child diagnosed with cancer, it's really the same thing. Just keep asking those questions, and find your community. Like for me, that was the biggest thing I could do. Like once Benjamin finally had that diagnosis, it was weird. Although it was like the worst day of my life, it was also like, okay, like a kind of like a sigh, like now we know what's wrong and now we can continue on the path to fix it, right?
Yeah.
So once I had that diagnosis, I was able to connect with other parents, other families, other moms who had children going through this battle. And that's what really helped me a lot. And that's why I want to help other families and moms going through it.
Yeah. And I know are you I know you're active on social media, but do you connect with other parents and other moms on social media too? Do you
Oh, yeah. Yeah. So I've connected with a lot of moms online, like just at the beginning of Benjamin's diagnosis that really like were my support and my strength at the beginning when he was really in that like tough part of treatment. Currently, he's in the maintenance phase, so things have slowed down a lot. He's doing really well, and now I'm able to help those parents that are in those really hard moments and kind of give them a little light, like there is an end to it, like things do get better. Because at the beginning I didn't believe that, but I had those moms telling me like it will get better, and if it doesn't, like we're here for you. So yeah, I connect with moms. I volunteer with an organization called POGO. It's Pediatric Oncology Group of Ontario.
Mhm.
So doing like a little bit of fundraising with them, as well as just connecting with other parents going through this.
Yeah. And so I mean, I don't know if you want to, but if you wanted to share your handle for if
Yeah,
anybody's listening and they wanted to connect with you, and
for
I
sure.
can share it in the descriptor too.
Yeah, for sure. It's Sarah DKXO.
Perfect. I will share it. Thank you so much, Sarah.
Of course. Thank you for having me.